I'm Business and Service Manager for Trauma and Orthopaedics. We're looking to integrate our services along pathways based on patient need. The introduction of Strata has greatly facilitated and improved communication between hospital and community-based therapists and nurses. This has led to better plans of care for patients, earlier discharge from hospital, and an improvement in the length of stay for our patients.
I was introduced to the Strata system whilst I was working as a case manager in the local hospital. I worked on all types of wards, both medical and orthopaedic. I instantly saw the potential in the system for improving communication between the MDT and how it would speed up referrals between departments. I ended up sharing the lead for the rollout of the system, and it was my responsibility to teach all the staff who were going to use the system, such as the physios, the OTs, the musculoskeletal staff, anyone really. We found that Strata is a simple and easy tool to use. It's a safe storage mechanism for all your records, and because it keeps records, any subsequent referrals that you make are often made easier because all the compulsory fields are already filled in. Each service, each department can tailor-make its own referral form, and this, as I've said before, includes compulsory fields, so this makes the quality of the referral better. There is other features. The dashboard, for instance, enables anyone who is coordinating a service to see what status a referral is at, whether it's been accepted or denied, and therefore this person can act quickly and rectify any problems. We also found that Strata, again, because it keeps a good record, you've got a good audit system, and it can also solve disputes in that if someone says that they've referred to you, you've got a record in front of you.
We've used Strata as a referral to the acute musculoskeletal inpatient OT and physiotherapy service for the last 3 years. The results of using Strata as a referral system have been to enable nursing staff to refer to us 24 hours a day, being able to refer to us when it suits them, not when we're available. It provides an audit trail of the referrals and the access times it's taken for us to see patients. And as a result of the successes we had within referrals to inpatients, we've extended this to cover intermediate care referrals and subsequently domiciliary referrals as well. It's minimised the number of rejections that we've had in terms of those referrals to other services due to the mandatory fields that we've entered into the referral criteria, and it enables a smooth onward referral between services following that.
I work in intermediate care. I'm one of the physiotherapists. And intermediate care is a place where hospital therapists will refer patients if they need further rehab or further assessment, sort of in a supported environment when they're not quite safe enough to go home. From a Strata point of view, we use Strata as our main referral from the hospital. So what happens is the hospital will fill in the referral on the ward, the physios and the occupational therapists and the nurses will fill in certain sections, mandatory field, and then we all receive the referral at our end. We receive them every day and we can check them throughout the day to make sure that it's accurate. And then the detail that's on the referral will then let us make sure we've got equipment and provisions available for the patient to then, as soon as possible, come to a bed and be transferred from the hospital. The functionality of Strata enables us to be more efficient in the way that we work. What happens is clinicians at the hospital can update a patient's mobility status, for example, so we get accurate, up-to-date information, and it's quite a nice. We make sure we get plenty of information on the referral and the mandatory fields, which also improves communication. Is that right? Sorry, I looked at the